Hello and welcome to Healthy Nation. I'm Pat Murphy. Every day, more than 16 million adults over 40 struggle to breathe because they have a condition called chronic obstructive pulmonary disease, or COPD. Now, there are some hereditary causes for COPD, but about 85% of cases are directly related to smoking tobacco. Let's hear from Dr. Holly Atkinson about how the lungs are affected by COPD.
When we breathe, air is pulled into and pushed out of the lungs. But when you have COPD, that transfer of air and even just breathing becomes difficult. Again, COPD stands for chronic obstructive pulmonary disease. In plain English, that means a long-term blockage in the airways. Most of the time, if you are diagnosed with COPD, it means you have bronchitis or emphysema that won't go away. There's also a third type of COPD that results from chronic asthma. That can lead to both immediate and lasting damage to your lungs and body. But before we talk about the effects and treatment for COPD, let's go inside the chest and see what happens as we breathe. When we breathe, air enters the lungs and moves through small tubes called bronchial tubes. At the end of each of these bronchial tubes are small balloon-like sacs called alveoli. These are filters between the air in the lungs and the blood that moves throughout the body. The thin walls of the alveoli allow oxygen from the air to go into the bloodstream and carbon dioxide to pass from the bloodstream into the lungs to be exhaled. This is what keeps the body's cells alive and functioning. When you have COPD caused by emphysema, the alveoli filters become damaged. First, their elasticity becomes reduced, limiting the ability for the alveoli to move as you inhale and exhale. Second, the alveoli become permanently enlarged, which increases the overall size of your lungs and puts greater strain on your chest muscles to breathe in and out. When you have COPD caused by chronic bronchitis, the bronchial tubes become inflamed and enlarged. This can narrow the airways. The air passageways can also become blocked because of increased mucus production caused by enlarged mucus glands. And finally, the cells that help move mucus out of the body can become damaged, reducing your ability to clear mucus from your air passage. More than 85% of COPD cases are caused by smoking tobacco. That's because a chemical in smoke stimulates inflammation in the lungs, leading to either chronic bronchitis or emphysema. Heavy smokers are at the greatest risk, and cigarette smokers have more risk than cigar and pipe smokers. The remaining causes of COPD are either unknown or, in a small number of cases, about 1 or 2%, are due to a hereditary condition known as familial emphysema.
COPD can make breathing extremely difficult, even under the easiest conditions. Watch our other segments to learn the signs, symptoms, and treatments available for this condition. Unfortunately, COPD is not a reversible condition, but it is treatable, and best treated if it's diagnosed and caught early. Dr. Holly Atkinson is here with COPD signs and symptoms.
So, how do you recognize the symptoms of COPD? The most common symptom is shortness of breath. For smokers, this may happen during exercise around age 40 and will get worse with age. But if you have familial emphysema, you may see symptoms much earlier. Gradually, the shortness of breath will occur even during simple activities. Chronic cough is common, with an increased production of phlegm. Another coughing symptom is coughing up blood, also known as hemoptysis. Wheezing, which is the high-pitched sound of air passing through narrowed airways, is typically heard at night. Chest tightness can occur, which patients describe as a feeling of constriction around their chest, like being wrapped in a blanket as it's slowly tightened. Based on these symptoms, COPD can be confused with asthma, but there are differences between these two diseases. The first is age. Unlike asthma, which typically develops in childhood, COPD occurs later in adulthood, as early as age 40. COPD can also worsen with age, where the severity of asthma generally stays the same. The second difference are triggers or causes of the disease. COPD is primarily linked to smoking and not triggered by things such as allergens and weather, which are common triggers for asthmatics. Finally, frequency of symptoms. COPD symptoms are chronic, meaning they can occur all the time. Asthmatics will have periods of attack and then are symptom-free between attacks. But it's important to note that some people who have long-standing asthma will go on to develop a type of COPD.
The key to dealing with COPD is diagnosing the condition early. And here's the tough love. You have to stop smoking. Believe me, I know this is hard to do, and it may take a couple of times, but there are a lot of methods that can help you. The longer you smoke, the worse the condition becomes, making it harder to breathe, even during everyday activities.
It can be really hard to quit smoking, and it may take more than one try, but you can do it. And when you do, you'll slow the progression of COPD and breathe easier. COPD is not a reversible condition, which is why it's so important that you take steps to prevent this disease and treat it early if you are diagnosed. Let's hear from Dr. Holly for more on preventing and diagnosing COPD.
The absolute best way to prevent COPD is to never smoke. But if you do smoke, now is the time to stop. The sooner you can quit smoking, the better chance you'll have at avoiding COPD. Remember, more than 85% of COPD cases are caused by smoking tobacco. That's because a chemical in smoke stimulates inflammation in the lungs. That can lead to chronic bronchitis or emphysema, making it difficult to breathe every day. To diagnose COPD, your doctor may choose to run some pulmonary function tests, or PFTs, to get a good idea of how advanced your symptoms are. The most frequent test is spirometry. This simple test can be performed in most physicians' offices. To do the test, you'll inhale as deeply as possible through a tube and then exhale as forcefully and rapidly as you can. Basically, it measures how much air goes into and out of your lungs. Other tests may also be done to test different parts of the lungs and their ability to transfer air into the bloodstream. These tests may also be given periodically during treatment to determine how well certain therapies are working. Sometimes a chest X-ray will be ordered to help rule out other potential conditions.
Diagnosing COPD early will help you and your doctor determine a treatment plan and make it easier to get the best results. To learn more about these options, watch our treatment segment. If you are diagnosed with COPD, there are a number of treatments to stop it from getting much worse. The key is to start treatment before it becomes too severe. Here's Dr. Holly Atkinson for more on the treatment options.
While there is no cure for COPD, there are treatments that can help you manage the condition and breathe easier. We'll talk about the different types of treatments, and you can pause at any time to write these down or read at your own pace. Drug treatments come in two major types: bronchodilators and inhaled steroids. Bronchodilators relax muscles inside bronchial tubes, which will help reduce overall airflow obstruction. They also improve the ability to clear mucus and the endurance of fatigued respiratory muscles. These also come in two main categories. The first are anticholinergics. These are used to decrease mucus secretions and are actually the drug of choice for COPD maintenance and may also help slow the progression of the disease. The second type of bronchodilators are beta agonists. These are used to dilate airways. Next are inhaled steroids or corticosteroids. These are also used to treat inflamed airways. These medications work well in about 10 to 15% of COPD patients, but overuse can weaken the bones and increase the risk of high blood pressure and diabetes. Non-medication-based therapies are also available, and your doctor may prescribe some of the following: oxygen therapy,
It comes in a variety of different forms, and it can be delivered with a variety of devices. Protein therapy may be prescribed for those who have familial emphysema to help slow lung damage. Your doctor may also suggest enrollment in a pulmonary rehabilitation program to help you exercise. Most hospitals offer these programs, which can improve fitness, even in severe cases. The programs usually include exercises for the upper and lower body, patient education, breathing retraining, and emotional support. Nutrition is also important. For patients who lose a lot of weight, high-fat, low-carbohydrate diets are recommended. If a patient is significantly overweight, losing weight is appropriate. Finally, your doctor may decide that surgery is required. Surgery can be done to remove portions of the damaged lungs or a full lung transplant in the most severe cases. Although there are good treatment options available, the best way to prevent or at least slow the progress of COPD is to quit smoking and see your doctor so you can begin treatment.
You can treat COPD if the condition is caught early. By watching, you've taken a great first step in learning more about this condition. Use this information to talk to your doctor if you believe you have the symptoms of COPD. Thanks for watching Healthy Nation. Check back soon to learn even more about your health.